The yeast otitis is really caused by allergy inflammation, so higher humidity, higher temperature, wax retention, and the yeast are like, oh, thanks, this is exactly what I wanted. So thinking of ways that we can help with the allergy inflammation in the ear canal and really inflammation in the whole body is the way to think about preventing these yeast otitis from coming back.
Hey everyone, and welcome back to Vetfolio Voice. This episode is sponsored by Decra, and I had the pleasure of welcoming Dr. Darren Dell back to the podcast to talk once again about itchy ears. More specifically, Dr. Dell offered some really helpful insight about managing yeast otitis, which is one of those conditions that feels both familiar and so frustrating in certain cases. Both of us agreed that Malassezia tends to be one of the easier organisms to knock out in an acute ear infection, but that keeping it from coming right back can be a whole different story. And of course, no talk about yeast otitis would be complete without addressing the role underlying allergies play in driving especially yeast otitis, and how it's critical that we manage both the infection and the other allergies for the best chance at long-term control. Dr. Dell and I also talked through some of the common missteps in selecting ear cleaners for maintenance use, and without giving too much away, I will just bare my soul a little bit here and say, as someone who feels like I have a relatively good track record when it comes to managing otitis, that part of the discussion was a bit humbling for me. So definitely worth a listen. And finally, we covered another treatment option that we now have available that could make a big difference in the way we manage some of these otitis flares. Duotic is a leave-in treatment with an antifungal and steroid. But get this, no antibiotic. So definitely an option to learn more about in a time when we're discovering more and more about the importance of antimicrobial stewardship. Anyhow, Dr. Dell is a wonderful speaker, so let me go ahead and introduce him, and you can hear more in his own words. Oh, and by the way, did I mention this podcast offers CE? So after listening, you can head over to the Vetfolio website and take the quiz associated with this episode, and that's all you have to do to earn your CE. All right, back to Dr. Dell, like I said. Dr. Darren Dell began working at the mixed animal practice in his small Midwestern hometown when he was 14. He attended Iowa State University for his undergraduate studies and completed his DVM at the University of Illinois in 2001. Dr. Dell knew he loved dermatology when he graduated, but he felt he belonged back in general practice. After 6 years working in general practice, Dr. Dell was ready for a change and had the opportunity to start a private practice dermatology residency. Halfway through the program, though, he was forced to change course, and for the next 2 years, Dr. Dell worked overnight emergency at a small specialty hospital. Finally, Dr. Dell finished his residency with Animal Dermatology Group in Indianapolis under the guidance of Dr. Lori Thompson, and he became a boarded dermatologist in 2012. Dr. Dell has been with Wheat Ridge Animal Hospital since 2017. Like I said, a wonderful speaker. Let's go ahead and jump in.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official human-animal bond certification from NAVC and HABRI, the Human Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at vetfolio.com.
I am excited for this episode. I'm joined again by Dr. Darren Dell. And Darren, it's been a long time since we've talked, but I remember our last conversation and I really enjoyed it. And then today we're going to talk again about ears and yeast otitis and things like that, which seems like it should be simple, but I feel like it rarely is. So thank you for joining me to jump into this topic.
Thank you so much. Yes, it has been a long time, but we always have such a great time, and this is such an important topic. I'm super excited we get a chance to talk about it.
Absolutely. Absolutely. So, thinking along those lines with yeast, I mean, on the one hand, I feel like when I see yeast, I'm like, these are often one of the easier organisms to get rid of in the ear. But, there's always those underlying things that go on with yeast otitis. So, from your perspective as a dermatologist, what should we know about yeast otitis?
Oh, well, I absolutely agree. When I see yeast, I think, oh, good. It's not Pseudomonas or it's not something,
Right.
we always think about those terrible bacterial infections that just linger and linger. So I think we all breathe a sigh of relief, but then we have to come back to this has to go away and stay away. And that's the trouble with yeast. Most of these yeast otitis problems are due to an underlying allergy. We can see yeast otitis with foreign bodies, with polyps in the ear, although typically those are going to give you a bacterial infection, but yeast can come along too. And then there are certain breeds that are just more prone to it, whether it's because their ear canal is so small, like a Shar or so big, like a Basset. Certain breeds just tend to have more problems with it. So lots of different reasons, and we have to think about all of them so we can make sure that we treat the current problem and prevent the next, 82 problems, ideally.
Yes, yes, because yeah, well, we start with this organism that's a little bit easier to kill than, but like you said, there's these underlying things where, it doesn't stay away, or we still have these anatomical or allergic conditions that are not controlled. And I always hate when we start out with that, maybe that really big ear canal that makes them more prone to yeast otitis, and
Hmm.
then we end up with a really tiny ear canal when it doesn't get under control for a long time. So yeah, it's like a sigh of relief, but also, oh gosh, if we don't get this under control, we're going to have bigger problems.
Right. I think people are just as frustrated by recurrent yeast otitis as they are with those, like I said, the Pseudomonas or E. coli's that never go away. It's still frustrating for clients, and it really is our job to try and explain the difference and how that changes our battle plan and how it changes the work they have to do at home. So it's important to have that discussion, and again, we're going to chat about that more. So excited.
Yes, yeah, absolutely. And, kind of what we're talking about here of like, okay, good, yeast, we can get rid of those a little more easily. It tends to do with their opportunistic nature. If I'm not mistaken there, that if we can control the environment in the ear, we can oftentimes control the yeast much more effectively. So what does that look like? How does that change our management approach?
So I should have already said, but I'll say it now, that the ear canal always has some yeast in it. So there is an amount of normal, quote unquote, for yeast in the ear canal. So finding one yeast organism on your ear cytology is perfectly normal. Some sources even say up to 2 to 4 per your microscope slide or microscope field can be normal. So keep in mind that if you see a dog and you swab its ears and you found one or two, hey, that's okay. That's within the range of normal. But you have to keep that in mind with your otoscopic exam. So if you saw a really red inflamed ear canal, or was really swollen or really itchy, and you found two yeast, well, you might say, well, I should go ahead and treat this because there's clinical signs to go with it. So your cytology is super important, not just so you can find out what organism, what am I dealing with, but also how much of it is there. But then you do have to pair that with your otoscopy to say how important is this clinically to this patient. So that's huge because yeast live there normally. Again, the I like to think of the ear canal as its own little environment. It's its own little place to live. It's still skin, but it has a unique environment, right? So we know that the ear canals make earwax. That's what they're supposed to do. Hooray. And that earwax comes out normally. Again, hooray, usually works just fine. But if we have something like allergy, which changes the environment, causing it to be inflamed, so it's more narrow or it's more humid, the temperature goes up, any of those things are going to predispose to yeast overgrowth. And that's kind of where I like to think about it starting. We have this perfect environment that they were born with, and then something changes that environment and it becomes more hospitable for yeast to overgrow. So it's not like yeast move in suddenly. They were already there. We've just changed it so they're more easy, or it's easier for them to grow. So that's part of where we have to think about, all right, how did we get to this point? Some of those very mild cases, or those cases that you see early where, again, you notice some excess debris, but the patient isn't really bothered. That's where cleaning may be all that you need to really kind of just get those yeast out of there, get the wax out of there, and kind of keep them at a normal level. So that's where we like to start. And from back in my general practice days, which was a long time ago now, but I think it is our responsibility as veterinarians to teach new pet owners or dog owners, or even if it's their 12th dog, the proper way to clean ears, and because it's part of maintenance, just like bathing your dog. It's part of maintenance, it's part of the general health routine. So ear cleaning is an important thing to talk about when you see clients.
That's a good point because I'm kind of reflecting now, and I feel like I used to have those conversations more often of, do you know how to clean your dog's ear? And here's how we do it properly. And yeah, if I can be, totally honest, it doesn't come to mind quite as easily of, oh, not only do I need to recommend that you clean your dog's ears, but I need to make sure that you're doing it properly. And we need to start this from an early age as it used to, because
Absolutely.
it just
Yeah.
kind of seems like one of those things that, of course, we're cleaning our dog's ears, but that's not really the case with pet owners.
Right. To be fair, there's so much you have to talk about, right? I mean, I get that. Again, my time in general practice taught me a lot of things, and it was a wonderful period of my career. There's a lot you got to cover in a very short
Sure.
period of time. So definitely, everyone can lean on their technicians and their assistants, and there are great resources, handouts, and videos to show how to properly clean ears. I think it's just something, even if you just mention it, it's one of those things that clients have to hear things multiple times. Even if we just mention it, hey, this is a good practice to get into, help desensitize your pet to this, help them, know that it's normal to have their ears cleaned. That goes a long way just to kind of try and get them in that habit. So don't feel bad. We all get stuck in that same trap of I've got 25 things to talk about, and then the owner also has things they want to talk about. Oh, and by the way, there's the ears. So it's okay. We all get into that situation.
Ah, yes, I appreciate the acknowledgement because sometimes it does feel like that of like, oh, did we talk about this? Did we talk about, we're predisposed to arthritis and we're,
Right.
need to clean the ears and oh, all the
Right.
different things, the
Talk
different
about flea
vaccines,
prevention and right,
prevention.
all those
Yes.
things you got to do. And then, sometimes, especially if you think, well, the ears look fine today, or they didn't ask about them, sometimes you just don't think about it. But yes, it's in the ideal world, it's something to talk about with puppies and new pet owners. Hey, this is good to get practice in, just to kind of so your dog isn't surprised if we have to do it later in life.
Yeah, and you're right. We
Yeah,
do have a lot of good options for like electronic resources where, handouts, videos, and
yep,
things where now maybe it doesn't take as much time as it has in the past when we didn't have those kinds of resources.
absolutely. Yeah, you don't have to put a VHS tape in the lobby TV anymore. It's just on their phones, so that's pretty
It's like
cool.
when you're in third grade and the teacher, like, we wheel in the television and put the tape in. Okay, let's clean ears today.
I really like those days because that means you didn't do as much work. So I like
Oh,
those days in third grade where you got the video out.
the best day. Yeah, you'd walk in the classroom and the VCR was sitting there. You're like,
Yep.
yes,
Yes. That paper isn't due today. Excellent.
yes. Uh, we digress here,
We
but it's
digress here.
fun.
Yes, everyone, good memories. But we should talk a little bit more about ear cleaners, though, I suppose, because there's a lot of different ear cleaners. I had a client ask me, with all the new things and all the internet, do you think people are more informed? And I said, no. I think people are more confused because
Sure,
there's so much, right? And it's hard for us as veterinarians to keep track of all of it. What is a pet owner going to do when they don't have the scientific knowledge to kind of figure out what's good and what's not? So there's so much stuff out there that it's still really important for us as veterinarians to be the ones who give them direction, give them, here's things that I would use in this situation. You may not have a favorite, or you may have a favorite. It doesn't mean there's just one choice to do all these things, but you can weed out the field a bit and narrow it down so they're more likely to make a good choice. So when it comes to kind of ear cleaners and things that I see, the first one that I want to mention would be acidic ear washes. So like malicetic is one of them. These have been around for decades, and acidic ear washes do work for yeast otitis, especially those mild cases, because yeast prefer a basic environment. So they like the higher pH. Use an acidic wash. Not only are you getting wax out, but and yeast, but you're also changing the environment so the yeast don't. It's not as easy for them to grow, right? So that's good. I don't actually stock an acidic ear wash in my practice because acidic ear washes really sting and burn if that ear canal is inflamed or ulcerated. So great, you got to kind of pick your patient. Most of the patients I see already have a pretty terrible ear canal, so I don't use these very
sure.
often. But again, in general practice, if you're just doing a maintenance thing, may be perfectly great for you and a lot of your clients. Just like getting lemon juice in a cut, though, just be kind of aware, pick your patient appropriately because you could sensitize that dog and make them never want another ear cleaning, and we don't want that to happen.
I had the opportunity to talk to you about this a little bit before we turned on the microphones. Just like you said, we need to kind of narrow the field and help guide pet owners a little bit. At least speaking for myself, and I hope I'm not alone in this, also as a general practitioner, appreciate the guidance from you and from your expertise because you painted a picture for me when it came to ear washes that I feel like at one point I probably had my head wrapped around this, but not so much in the recent past
Fair
here.
enough.
And
Very fair.
talking about pH, because if we're talking about yeast otitis, we have cleaners out there that include ketoconazole, and it seems logical that we would use something that contained an antifungal if we were
Yep,
trying to control recurrent yeast otitis.
it
But
does.
there's some other considerations there, is what I understood from you.
Correct, correct. So there are a number of ear washes that have ketoconazole in them. Most of them are paired with trizi-DTA. In fact, I think all of them are. I think it's often misused for just this purpose. So again, if you've been practicing for quite some time, you'll remember the days when trizi-DTA had to be mixed in your practice because it wasn't stable. They hadn't figured that out yet. And what we found back then, this is 25 years ago, you'd use your trizi-DTA for like a Pseudomonas or an E. coli, and you would get rid of the bacteria, and you were so excited. But then the patient would have yeast
Yep.
otitis. That's just how it happened. And a couple of things go on there. We kill these big nasty bacteria, but the ear canal is still inflamed. So it's still an abnormal environment. And yeast are like, well, okay, this is great. They're not picky. But the Trizi-DTA also makes the ear canal a basic environment. So the bacteria don't like the basic environment, but the yeast do. So it's one of those you can't win sometimes. So the idea of those Triz keto ear washes was, okay, let's try and prevent the rebound yeast infection. Nobody wants the rebound, significant other. We don't want that. So we didn't want the
Right.
yeast, right? It's no good. It never works out. So that's where those Triz keto washes come in. They're not great at preventing yeast otitis because again, you're making the ear canal basic so the yeast like it. You're tossing some ketoconazole in there, but it's kind of a mixed message, right? You're going to kill a few with the ketoconazole, but it's still an environment that they like to be in. The other thing that I found is I think a lot of those Triz keto washes aren't as great at dissolving wax. So we all know, like, your Pseudomonas or your E. coli ears, your really nasty infections, those typically come with that mucousy kind of slimy stuff in the ear canal, right?
Right.
Whereas your yeast otitis is often the thicker, black, brown, kind of real sticky stuff. So again, Triz keto washes, great for the bacteria, but doesn't dissolve that thick kind of really sticky wax as well. So you're putting ketoconazole on top, that's great, but you're not getting the wax out and you're making the environment more hospitable for the yeast. So that's one definite situation where don't use those Triz keto washes as a maintenance for your recurrent yeast dogs because it's not going to be the best solution for you. So when I think of using my ear washes, again, the Trace Keto washes I'll use for the nasty rod bacterial infections. Sometimes I'll use an acidic wash or recommend it if it's an otherwise happy, healthy dog and the owner just wants some prevention. But a lot of times I'm using a neutral pH ear wash that's really just great at removing wax. So again, harken back to vet school. Most of the Malassezia yeast that we find on dogs are lipid dependent. Not every species is, so we could get into the weeds there, but most of them are lipid dependent, meaning that they need a fat source. And earwax happens to be one of those fat sources. So if we can clean the earwax out effectively, then we're taking away their food source, or at least we're reducing it. So that's where I usually go. And finding a wash like a micellar solution or even just a good neutral pH ear wash solution really helps you dissolve the wax and get it out. That'll do a better job than these Triz keto washes that are making the environment more hospitable and not getting the wax out. So again, I know we're kind of diving into the weeds as far as not every ear wash does the same thing, but it also doesn't dissolve wax as well. Almost like if you think about, any other thing you use for cleaning, right? If your dish soap or your laundry soap, no, they're not all quite the same, and you have your favorite for different things.
No, and that makes sense. Kind of like we alluded to in the beginning, that ears are just, they're complicated in their own different ways. Every skin thing can have its own
They're all
share of
right. Looks
complications.
simple on the outside, but not quite so much.
Right, right, exactly. So it is important, I think, to, even though there's a lot of detail, to really think about that and what exactly it is that we're managing. Because to your point, saying, okay, well, these acidic ear washes work really well, but if we use them in a dog who's having active otitis, then we might be setting ourselves up for failure, even if we get rid of the
Right.
yeast. So
Correct.
different washes for different situations. I wanted to ask you about the micellar products. I
Hmm.
I feel like I haven't used one in a little while. I feel like maybe I've seen a little bit of inflammation as a result of using some of those. Are those more like limited use ear washes, or can those be a maintenance?
That's a great question. So the micellar cleansers can be used as a maintenance wash as well. The idea behind the micelles or in the micellar solutions is that they mix with the wax and dissolve it, rather than your other solutions are really just trying to physically like loosen it. So other things we use to dissolve wax are often either very greasy. If you think of like the old days to clear otic and things like that, very greasy solutions will dissolve a thick wax. Just again, just like anything else you have to clean. If you have a thick wax and you put another greasy substance on it, you'll
Yep.
loosen it, but then
I'm
you've got
going
a
back to
different
like freshman year of
way
undergrad
back.
gen chem,
Right.
like dissolves like.
Yes, but you'll get a giant mess.
Right.
So the micelles actually mix with it and dissolve it without making a huge mess. That's why you see a lot of micellar face wash solutions for people, because you can dissolve like, for teenagers, get that oil off the skin without drying it out. So that's nice. A lot of the other things are the older cleansers we used, I guess is the right term. Other ingredients like witch hazel, that'll dissolve wax, but it also is very drying and can be irritating. So the micellar solution should always be okay, just like the neutral pH, really okay in every ear. And I don't, just to be clear, I don't recommend having 20 different ear washes in your practice. I think you can really get by with two or three. So I'm the same way with shampoo. We're not talking shampoo today, but you can really limit the amount of products you have and simplify it for your clients and for your staff. So for me, I do keep a Tris keto type wash because there are times when you've got a Pseudomonas or an E. coli ear, and I keep a micellar wash because I think it's great for those thick, waxy ears. And then I keep just a plain old neutral pH wash that I would use for any healthy dog if people ask me. So three is really all you need. You can get fancier and carry more, but what I found is the more products you carry, the fewer of them you use because it just becomes overwhelming. So it's that keep it simple principle.
Yes. Well, and with having access to online pharmacies and things like
Sure.
that, we can really expand our access to inventory without having to physically stock it on the shelf. But
Absolutely.
to your point, it can't, with all the different options, it can get really complicated. So, kind of having a basic idea of what you want to use for each condition makes a lot of sense.
Absolutely. And it's just easier for your whole staff too.
Sure.
So that's nice. We kind of touched on it before, the reason that I like to talk to folks even when the ear canal is normal, whether I'm seeing them for allergy or whether I just, somebody says, I got a new puppy, what do you think? I'm like, okay. Especially if it's a French bulldog or,
Right.
English bulldog. I'm like, oh, that's great. Here's the 20 things you need to do for maintenance, right? But it is good to talk to people about, just like we say, touch their paws, practice touching their nails, get the nail trimmer out. The same goes for the ear cleanings so that they're not scared by it. Think about, if someone only you shook your hand when it was in pain, you wouldn't want to shake anyone's hand, right?
Sure.
Same thing goes for ears. If we only touch them when they're painful because they have an ear infection, of course we're gonna, they're not gonna like it. And unfortunately, because many of these dogs do have a recurrent problem, they remember, just like they remember if you give them treats and are excited when they come into the lobby, they remember if their ears hurt and you are messing with them. So not only do we want to practice during the good times to reinforce that, but we also want to think about discomfort and anxiety when they have an ear infection. So this is kind of a soapbox for me to remember that there is a dog attached to the ear, and that dog feels pain and anxiety and stress and they love their owner, but they're worried about these things. So don't forget that if you have a bad otitis, you can tell if the dog's uncomfortable typically. Sometimes I ask the owners just to kind of get their feelings to see how well they're in tune with their dog or what their thinking is. But I often send my otitis patients home with a pain reliever and sometimes an anxiolytic as well, just for the short term. Maybe it's just a week to say, hey, let's calm this down and make it easier for all of you, right? Like
Right.
we've all heard that, the client that kind of chuckles a bit and says, oh, he runs away when he sees the ear wash. Well, that actually means that he's either scared of it, it means he's just
Right.
scared of it. That's all it is, right? He doesn't run away from treats, right? Because he loves those. He
Right.
runs away from something he's scared of. So we really don't want that. I don't really expect them to love it per se, but I don't want them to run away from it. It kind of hurts my heart a little bit. So just keep in
Yeah.
mind that pain relievers, anxiolytics, we have them. They're safe. They're not expensive these days. Use them. Again, I know it's another part of the talk, but incorporate that or try to incorporate that into your otitis talk.
I think that that's such good advice because I think the last time you and I spoke, we talked about starting steroids for a couple of days
Yep,
beforehand to reduce the inflammation and make these pets more comfortable for treatment so we're not sensitizing them and making them so painful. And then also I know when we talk about any talks we do on procedural sedation and things like that, ear cleaning is one of the biggest procedures that comes up of these
absolutely.
dogs that are painful. Why fight them through this if they're really hurting let's go ahead and like you said, manage their pain and take some of the fear away. So it's not every time they walk in the door, they're, oh, you're going to touch my really painful ears.
Right.
And it gets worse and worse and worse over time.
Exactly. Yeah. I mean, again, a lot of these are recurrent problems, and you're absolutely right. Steroids are often needed. I would say almost always, but you may choose to not use a systemic steroid because the dog is older, or the dog has a heart problem, or the dog, there's a billion reasons why you might not choose to use an oral steroid. You might just rely on the steroid that's in the ear product. But even in those cases where you can't use a systemic steroid, you could still probably use a pain reliever and an anxiolytic. So
Sure.
yeah, pick and choose. I mean, that's why we're the veterinarians. That's why we know our pets and we know the whole picture. We're the experts, but just definitely keep all those steroids, pain relievers, and anxiolytics in your mind when you're thinking about how am I going to help this pet and this pet parent get through this and again not have more. So
Absolutely.
sorry,
Absolutely.
soapbox issue.
No, it's a great soapbox because it's so important. When we're talking about low stress handling and, no longer trying to take our pets and as a square peg and put them into a round hole of like, well, you need your ear clean, it's for the best, but
Right.
instead working with them. So I think it's a really important soapbox.
Yeah, it just that's one of the biggest things I think we don't appreciate over the last 20 years. Again, I'm back on the soapbox, but we've had a lot of great advancements in veterinary medicine,
Hmm.
but the amount that we can do with pain and anxiety over the last 20 years, that's huge. And it seems so simple that sometimes we forget, but oh, it's such a big deal.
It really is. It really is. And I think that actually kind of dovetails nicely into the types of products that we have available because if we are treating a painful ear or a dog who has had a bad experience in the past and
Yes,
has a lot of fear and anxiety around having their ears handled, it might change which product we reach for. So can you talk about that a little bit?
absolutely. Yes. It's always people ask sometimes, well, why do you use this product over that product? Or, they all have the same, this has this ingredient, that one has that ingredient. And the answer is, I talk to the client and I
Hmm.
ask them, I very honestly, what can you do? Do you have three kids at home? Maybe you just broke your wrist? I mean, we all, these things happen. So we
Sure.
really have to have this conversation with the client about what they can honestly do. Again, we're there to advocate for the pet and really kind of explain what we think the pet's going to be okay with. But then the owner has to also have an honest conversation with us. So we're really lucky just now to have a new ear product for yeast otitis. So up to this point, we haven't had any product that's just meant for yeast otitis. So if you look at all of the ear products on your shelf in your clinic, they're I would bet all going to have an antibiotic, an antifungal, and a steroid. So
Hmm.
that's just what we had. I think that notion started back in the 80s and it's carried on through. And while those work, we don't really want to expose these pets to antibiotics if we don't have to. Just the whole let's not get more antibiotic resistance if we can avoid it. So
Sure,
we're
gosh,
we're
and the
lucky enough.
effects we're seeing with like microbiome and dermatology and
Exactly.
all this, there's so much to be uncovered there.
Absolutely. And we're going to see more of that too. But
Hmm.
up to this point, we haven't had any commercial product that's just an antifungal and a steroid. So we're lucky that we have a new product that does that. That's Duodic. I'm super excited about it because it's also a leave-in product or a residual product. So this is a point of distinction. Sorry, another soapbox. Leave-in products or residual products. Those are your Duodic. These are these products that you put in the ear canal and they last for 30 days. Duodic actually lasts for 45 days, but they last for a period of time. But they do not occlude or pack the ear canal. So OD packs, which many of you have heard about or used maybe in the past, were the sort of compounding solution before there was a commercially available product. OD packs are not the standard of care these days. Just think of the name. It's a pack in the ear canal. We do not want to cover the ear canal. We do not want to close it off. It is not meant to be that way. So, one way to think about these OD packs is, what if you put a bandage on a foot for a wound and then never changed it for
Sure.
3 weeks? Would that bandage look very good? How would that skin underneath there look?
Ugh,
Yeah.
stinky.
Yes, I can smell it right now, and
Yes.
whoa, that's why I never bandage anything these days. Whoa. So we don't want to cover the ear. We don't want to pack it full of stuff, because that really it again it doesn't help us with the moisture, with the airflow, with the humidity, any of those things, it doesn't help us with that. And sometimes the Odipacks can become foreign bodies too, depending on the consistency of them and what they're made of. They can serve as foreign bodies in the ear canal later on that cause more trouble. So residual products or leave-in products, however you want to call them, are not the same as Odipacks. I would strongly encourage you not to use Odipacks anymore because they're not standard of care. These leave-in products, again, give us a long period of time of treatment for duotic. It's 45 days. It's 2 doses administered a week apart. And the owner then doesn't have to physically do anything with the ear, which is great if the dog is sensitive or the owner is going out of town or they just broke their wrist or they just had a baby or, a billion other things we've all heard. So it can treat that ear canal for that long period of time, but still leave the ear canal open to become normal. There's still airflow back and forth, sound goes in and out, and we don't get this sort of packing in, or we don't get this high humidity and moisture in the ear canal that stays there. So the residual products are great. You do still need to make sure that you in the clinic can examine the ear canal. So we want to get a good otoscopic exam and really clean it well, because with these residual products, you're going to clean the ear, let it dry for a bit, put the medicine in, and then there's not going to be any more cleaning for 45 days. So that's pretty great for the owner and pretty great for the pet too.
Gosh, 45 days. That sounds yeah, ideal because, kind of like we've talked about before, these pets are so painful and oftentimes
Yes.
sensitized to having their ears handled. So to be able to really get them a vacation from any of that for a long while,
I like
it
that word
sounds,
vacation. Yes,
yes.
a vacation, and it feels that way for the owner too, right?
Right.
Like they get a vacation, they it takes the stress off them. They're like, oh, I don't have to worry about this, and just sometimes just reducing that stress for both the pet and the owner is huge. We do want to encourage that human animal bond, and this is a product that can help us with that.
Absolutely. And like you said, and we're not exposing them to antibiotics unnecessarily because a lot of times in these allergic pets, yeast does end up being our primary problem. At least,
Right.
we hope so in a lot of cases. And we're not looking in those ears and they're full of snot and biofilm and all these other things. And we are dealing with
Correct.
yeast.
Yes, and that's what I've seen. I've been practicing for a long time now. I'm at year 24. I think for a lot of these allergy patients, yeast comes first, almost always comes first. But if the owner doesn't notice it, or if it's just not very obvious, then enough irritation happens, and then bacteria kind of comes secondarily. Typically, it doesn't always happen that way, of course. There's no always, but oftentimes that yeast otitis comes first, and it's just kind of this low simmer, right? Until something else, either they just build up enough or there's an allergy flare that makes it worse. So if we can get them in and treat them early, then the yeast infection doesn't become something more severe. And certainly letting our clients know that they've got easier options, hopefully they bring their pets in earlier for treatment.
Absolutely. Yeah, they're more encouraged to bring their pets in and treat because it's not like, oh, all right, I'm going to bring them in, and and it's going to be expensive because of course we hear that a lot, and I
Everything's
and I
expensive. Yep.
understand. And then they're going to give me this ear medication that I'm going to have to fight with my dog for 2 weeks and then bring them
Right.
back in. Like, yes, if we can make that whole process easier, then everybody wins.
Right. I do think for a lot of folks, they complain about the price, but so I think just more so it's oh my gosh, I have to do all this work and my dog isn't going to
Hmm.
like it. Right. That's almost more difficult for them, but price is an easy thing to mention or complain about. But
Sure.
a lot of them are just they're softies. They love their pet. So, definitely these easier choices are great for them. The other nice thing about this 45 days is that if you think about a typical pet's allergy flare, that 45 days might cover the entire span of that, which is pretty darn nice. So obviously we want to do other things for the allergy where, whatever that may happen to be. But if you've got one, you're like, gosh, every, July and August, always tough. You might get through that entire season with 1, 2 dose treatment and help everybody out.
I love those July, August, those ones that you can map it and you're like, all right, I
Yes.
see it coming. Let's go ahead and intervene early.
Yes.
And those pets do so well in the long run because they don't get that sensitization, and you
Right.
get these owners that are really compliant. It's the ones that are, that constant up and down where
Yeah.
it is hard to map. And I'm wondering if we can circle back around to those a little bit here and talk about what we should be considering outside of management for otitis in these recurrent cases where, like you've mentioned, a lot of times there is an underlying allergy involved.
Right. So a lot of it, that's a really good point. And clients kind of, I think, look at me funny when I start geeking out about, but it's every July, or now we know the
Yes, get
pattern.
so excited.
Get so excited because we can plan for that. We can do something. So, obviously, sometimes we all geek out on things. We're veterinarians, so we like the science and we like the pets. So, I don't know. I think some people listen. And most of the time, our pollen levels are, or the pollen exposure is seasonal. Now, pets may go from one pollen to another pollen, but that doesn't mean you can't map it and try and give them some tools or give them some clues about when they should pay more attention. So, absolutely, anyone who's willing to listen about that is great. As we started this whole thing, this whole talk, allergy is typically the underlying cause for otitis or recurrent yeast otitis externa. So really kind of getting to the bottom of, what could that allergy be and thinking about food allergy versus environmental allergy. And then what kind of treatments are going to be best to help us with the ears? So the struggle that I find with yeast otitis or really any allergy-induced otitis externa is that many of our current allergy medications aren't meant to prevent otitis. So I don't know if we're off topic or not here, but I'll keep going until you stop me.
No, I,
So
I love it. I'll take any and all information on
okay,
managing allergies.
okay, great. So most of our new allergy medications are focused on itch relief, which is fantastic, right? I mean, again, I can remember 25 years ago where it was, oh my gosh, I can't sleep at night. The dog can't sleep at night. He's always restless. He's uncomfortable. So we were lucky enough that several drug companies have made excellent products to stop itching. And that obviously gives us a whole lot of relief. Dogs can sleep, owners can sleep. We don't get the secondary trauma to the skin. But in a lot of cases, those anti-itch medications don't necessarily do a great job for preventing yeast otitis. And really, what I've come to learn over time is just the yeast otitis is really caused by allergy inflammation. So when your pet is exposed to an allergen, whether it's a food allergen or an environmental allergen, it really sets off this inflammatory cascade. And we're learning more in people and in dogs how bad inflammation is for you. However, whatever study you want to read, whether you're really, holistic or whether you're really heavy in the science and the medicine, inflammation, excess inflammation is bad. That's just the
Right.
truth of it. And this inflammation sets off this huge pathway, right? Our clients often ask us about antihistamines because that's what they know. And histamine is one tiny part of the canine, inflammatory allergy cascade. Itching is another part. But there's a whole lot of just other inflammation that happens in the skin, and that's where we get these changes that, affect the hair coat and affect the body odor and affect their predisposition for infection and affects swelling of the feet and swelling in the ear canal. And I think it's when the ear canal swells that we get higher humidity, higher temperature, wax retention, and the yeast are like, oh, thanks. This is exactly what I wanted. So thinking of ways that we can help with the allergy inflammation in the ear canal and really inflammation in the whole body is the way to think about preventing these yeast otitis from coming back.
That makes sense. Yeah, controlling the inflammation. And of course the itch is important, but if we don't get that inflammation under control, then we're we're not going to be as successful in managing
Absolutely,
the yeast.
absolutely. And several years ago, there was a study which I'm sure very few people read that looked at, where different breeds of dogs demonstrate their allergy signs. And they went through, like German Shepherds are different than bulldogs. I mean, if you think about that, of course they are. And
Right.
boxers are different than Labradors. And again, stop and think. Yes, they are. But this study showed that, yes, across the board, these are real things. It's not just your anecdotal experience and mine. It does happen. And I also think we could go one step farther and say some breeds have more allergy inflammation, some have more allergy itch, just the way they're made. I think bulldogs and bull terriers and boxers have more allergy inflammation. Think about the swollen feet and the swollen ears,
Right.
even the swollen faces sometimes. Oh my gosh, those poor dogs, where their eyelids swell because of their allergy, versus your golden retriever that just scratches all the time. So just, different breeds do different things. And so we're lucky enough to have so many different products these days. Really start to think about, hmm, for this symptom, or sorry, clinical sign, I have to get it right. Dogs have
Sure.
clinical signs, but when I talk to clients, it's a symptom because that's what they know. Which of these clinical signs or symptoms do I think is going to be best respond to this medication?
I think that that makes a lot of sense. I had it explained to me recently because, certainly that's been my experience when trying to manage generalized allergy symptoms of, dogs responding differently to a different management strategy. I think someone explained it as they're expressing different cytokine profiles.
Right.
And so it depends on the cytokine profile for that individual dog, what they're going to respond to and what's going to be successful. So if you use a medication and it fails, it's not necessarily because you made a mistake or did anything wrong. It's just the cytokine profile for that specific dog is not fitting what this drug is addressing.
Correct, correct. And they just keep finding more cytokines. So that's the struggle there. If you want
Yes.
to go cross-eyed reading immunology, go to look up all the cytokines because there's more and more and more and more, which is great. We're learning, but we're also learning how much we don't know, right?
Right.
So every patient, again, there are breed kind of similarities, but every patient is going to have a different cytokine profile, a different inflammatory profile. So it's not that you failed, but it is kind of that you just need a different approach. And so because we have choices and because clients are sometimes frustrated, I think it's best just to say, this is what I think is going to work best for your pet's symptoms. However, every dog is unique. They're allowed to be. That's why we love them. But that might mean that this isn't the right choice for your dog. So we may have to try a different one. So just kind of set yourself up for success. Don't say, oh, this drug always works and it's the best and whatever, because that's what they hear on the commercials, right?
Right.
So just kind of let them know that, hey, it's okay to be an individual. That's what we are here to treat. We're here again as the experts to say, I know your dog, I know what's going on. Here's what I think is best, but you're an individual, and it might be this other one that's better for you.
And I think that's such a good point and such a perfect way to wrap up this discussion is with client communication because with
Yep,
anything dermatology, I mean communication with the clients is critical because these are lifelong, progressive, ongoing conditions that
absolutely.
require some degree of management throughout the pet's life. So I love the way you put that as far as explaining there may be a little bit of trial and error involved because your pet is individual and we have to find out what works for them. Are there any other client communication tips that you find work really well and you think would be helpful in explaining these different conditions to owners?
So that's a great question, and I'm sure that everyone has their own little tips as we learn and go through this practicing veterinary medicine, as they say. But one that also helps me is just to remind folks that allergies is a moving target. Allergies are a moving target, so it's different in June than it is in September. Depending on where you live, it might be worse in September, right? So it's a moving target. Lots of times I'll see, just as an example, I'll see patients with allergies and an autoimmune skin condition. Usually the autoimmune skin condition is easier to control because it's fairly steady. Once we have a management plan, it's steady. Whereas allergy comes and goes and the weather affects it and how much moisture you have affects it. And did you move? Did you travel? So just like to remind people that allergy really is a moving target. We want to make a plan that's safe and efficacious, but we're not going to over medicate your pets, right? So we're going to plan what's going to work 80% of the time, but there could be a flare because it's a moving target. The other thing I like to remind folks is that different pollen exposure can cause different symptoms. So people know this and people talk about it. We don't talk about it much yet in veterinary medicine, but one pollen could give your dog an ear infection and another pollen could trigger a pyoderma on the belly. As weird as that sounds, it's all about comes back to those cytokines and your immune system responding to what it thinks is a different threat, right? That's what an allergy is. It's seeing these normal things and thinking it's a threat. So it can be different at different times of year. It can be a different symptom at different times of year. So really just letting clients know that they're not crazy and that we want to know what they're seeing because we value their input and that really working together, again, being proactive, but working together is the first part of that. You have to know what's going on as a veterinarian. Then you can be more proactive and you can help them understand it and really prevent it, medicate it. I'm always super excited, when I have a client. I had one yesterday who's just so fantastic at dealing with his bulldog. He's got a bulldog. He has two,
Oh
actually,
gosh.
and he knows the wiping, he knows the bathing, he knows the ear cleaning. That's his maintenance routine, right? His dog's on allergy shots. It's also on an allergy medication. He also has what I do when there's a flare. Here's what I do when there's this. So I've given him the tools. Not that I'm special, but this is our plan. Give them the tools and give them the knowledge to say, okay, here's my base plan. Oh, I think here's a flare. I'm going to treat it early. And then with that comes also when do I call the veterinarian? When, I've got my base plan, I've got my first line of defense, and then if it overcomes that, then I call. So giving them the power to treat those things early and to be a part of the plan really helps. It really empowers these people to, be an active participant rather than just feel like, oh, here comes, here's another mess and now I've got to deal with it. If you can empower them and give them the tools and the understanding, then most of them will come along and really be great partners in helping that pet out.
I'm thinking of these pets that do something on a predictable schedule, like we talked about those July, August dogs that, they always flare at that time of the year. I can absolutely appreciate how it could become frustrating very quickly for an owner to say, we do this every year and here I
Right.
am. But, if there's good communication and management going on, I love the way you put that of giving them the tools to kind of know what to do because we're doing the same thing every year. And
Right.
then when things do get beyond the ability to be managed by our typical management plan, then we can jump in. And I think that probably creates a more compliant, more cohesive plan and keeps these symptoms under control in the long term for the pet much better than not giving them the tools and not having
Right.
that really strong communication.
Absolutely. Absolutely. And of course, not every client is going to, be a
Sure.
part of that. We know that.
Put them on
But
flea prevention for goodness sakes.
right, exactly. Not everyone's going to listen to what you say, but a lot of them will, right? And at least you've tried. So, we don't, as veterinarians, we don't like treating the same thing over and over again either, right?
Right.
It's frustrating for us. So, what I always tell them is, this flare isn't, we didn't fail, we're just learning, right?
Right.
Either we learn from this or we succeeded. That's how it goes. So if we got through the year without a flare, then we succeeded. We did a great job. If we had a flare, then let's learn from it. Let's make a different plan. Let's give you some tools to use. So nothing's ever a setback. It's all about learning so we can do better next time. And if you kind of change again, some of them listen, some of them don't, but it's worth a shot to say let's do this different next time because we don't like doing the same thing either. It's no fun.
Yeah. Gosh, I feel like you're talking to like general practitioners and veterinary staff just as much as clients there of like we didn't fail, we learned. And I'm
We
like, "Okay,
learned.
okay, I
Yeah.
hear you. We learned."
Right. Let's use this and let's get better next time. I mean, that's all we can do. That's with these
Absolutely.
with these lifelong conditions, that's what we have to think about. It's never going to be perfect because that's life isn't perfect, but I can learn from this and I can do better and I can adjust.
Yes, yes. Well, Dr. Dell, as always, it's been fantastic talking to you. And I feel like this talk is full of just really helpful clinical information and things to keep in
Hooray.
mind for a really, what can be a difficult condition to manage. So thank you so much for joining me. Are there any final thoughts you want to share?
Well, I just want to say thank you too. I know sometimes I get off on my on the history lessons here, but I guess that's the nature of being in practice for a long time. But I do think there's a lot of great information. There's a lot of things we can learn from each other, and really just focus on talking to these clients and really bringing them into being a partner in the treatment. And then I guess just my last little tip: don't forget about these residual products because they can make your life easier. Use them, use the commercially available residual products because again, they are FDA approved, so they're consistent, the quality is there, the reliability is there, and then Duotic is a great choice for those yeast infections this year and moving forward because it doesn't have the antibiotics, so it has a great steroid, has a great antifungal, and I think it's going to be a big game changer this summer as we move into allergy season and we see those allergy-induced yeast otitis. So give it a try. I think you're going to like it, and I think it's going to be great for the pet parents.
Absolutely. I love it. I'm excited to have more options. We can always use more options when it comes to ears.
Absolutely, you got it.
So, was anyone else humbled by the discussion over choosing an ear cleaner for maintenance use the way I was? I'm really hoping that I'm not the only one out there. Thank you for tuning in. I hope you learned a lot, just like I did. A big thank you to Decra for making this episode possible, and thank you to Dr. Dell for joining me. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you enjoyed this episode and you'd like to hear more, you can find us wherever you get your podcasts, or you can click on the education tab on the Vetfolio website. We would certainly like to hear your input on this episode and ideas for what you'd like to hear in the future, so please reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.